We have a little bit less experience on patient relapsing with CLL after CAR-19, again, because the numbers are lower as compared to patients with commercially approved indication like diffuse large B-cell lymphoma. But resistance is certainly a thing. It's a real thing in CLL. And one of the main reasons why CAR T-cell have been sort of lagging a little bit behind in CLL is because by definition, in CLL, you have a T-cell dysfunction to start with. So when you have a T-cell therapy like CAR-19 that relies on the function of the T-cells, if the T-cell of the patients are already not working, well, that can be an issue. And so and there are papers showing the defects on T-cells in general and papers showing the defects of CAR T-cell in CLL in more detail. And so certainly an issue is T-cell dysfunction in the resistance, and so strategies to enhance the function of CAR T-cell in CLL are definitely needed. We have developed years ago with Dr. Freire and Dr. Sargil here at Penn the idea of combining CAR T-cell with Ibrutinib, for example, is a BTK and ITK inhibitor, as you know, is widely used for CLL. And we showed that in both CLL and mantle cell lymphoma, the use of Ibrutinib combined with CAR-19 leads to a better anti-tumor effect. And we think it's not only because Ibrutinib can also kill the leukemia or lymphoma cells, but it's also because Ibrutinib can have a beneficial effect on the function of the T cell. And now there are several studies ongoing. The Seattle group has published one, and other groups are publishing big multi-center trials with the combination of CAR-19 and Ibrutinib. So, for example, that would be a potential strategy to improve CAR-19 in CLL by combining with Ibrutinib. And so resistance is still an obstacle to CAR T-cell in CLL, but I think with the experience with combining CAR T-cell with small molecule, we've shown that, at least as a proof of principle, that patient can overcome this resistance if we put together the right regimen. Other regimens that might potentially address resistance is combination with other agents. But again, for example, would be very interesting to evaluate the combination with BCL2 inhibitors. But obviously, every time we combine CAR T-cell with another agent, we need to make sure that the other agent doesn't affect the function of the CAR T-cell. So a lot of studies are ongoing in the preclinical setting, some of them in the clinical setting. But I think the number of patients that will be showing resistance to CAR-19 would be much lower in CLL when we would be able to develop successful combinations.